Hi, everyone. Welcome to today's webinar. We're so excited to have you with us. We're just going to get started here in about a minute or two. We're going to let folks trickle in and then we'll get started with the program. So thanks for joining us. All right, let's go ahead and get started. This is so exciting. Welcome to today's webinar, Prioritizing Student Mental Health in Colleges and Universities. It is April 1st, 2025. I'm very excited to have you with us and very excited to keep it moving. So just a few housekeeping items for today's webinar. All webinar functions are located on the toolbar at the bottom of your screen. A few things we want to highlight. The Q&A box is really where we want you to be adding your questions. We do have some fine National Council colleagues on the call to go ahead and be answering your questions. You won't be able to unmute for this webinar as we only have an hour, as much as we'd love to be able to talk to folks and take some live questions. The Q&A chat function is really where we hope to see your questions. Closed captioning, if you do would like and or require closed captioning, please select live transcript and then select show subtitle or view full transcript. If you require any sort of assistance there, please do reach out to us and we're happy to support you with that. And again, if you experience technical difficulties or problems, more than happy to connect with you via a chat message to one of our hosts on the call, one of which is me. So just want to take a moment to introduce the Mental Health First Aid USA team members that are on the call. You may recognize the first photo because that is in fact myself. My name is Janice Ann Shane, and I serve as Director of Client Success here for Mental Health First Aid, and I am so pleased to serve as your moderator for today. My colleagues, Ashley Connor, who's a Senior Client Development Partner, and my other colleague, Adam Miller, who's Client Development Partner as well, are going to be staffing our Q&A box today. So these folks are highly skilled and very knowledgeable about mental health first aid and about higher education and our products that are in the higher education space. So if you have any questions about anything related to that, and well, any questions at all, you're welcome to share those in the Q&A box as well. Great. So without further ado, I'm so thrilled to be able to afford the opportunity to our panelists to introduce themselves and tell us a little bit about their experience in higher ed. Then we're going to get into the questions. So Dr. Ford-Wade, I'd love for you to kick us off.
Absolutely. Thank you. And thank you for the opportunity to present today. My name's Allison Ford Wade, and I'm currently serving as the interim chair and professor of public health. And I'm also an associate dean of community engagement at the University of Mississippi, also known as Ole Miss. And how I began this work was coming out of COVID. We were able to, in some conversations around campus, specifically with our counseling center on campus, we begin to hear, and everybody on the call probably did as well, right? Is we began to hear that we were about to experience something coming out of COVID that was going to impact significantly our campuses, our students, and our communities. And so we were able to get some COVID relief money, small amount of money. We put a call out. We worked with the counseling center. We put a call out campus wide and said we would like to embed mental health first aid instructors on our campus to help our counseling center and help our campus community. We had funding for 16 instructors, and we had about 100 people apply. And so we were strategic in being able to place those. We sort of place some of them in student success, some of them in academic departments, academic advisors, and saw just great success from that. We then turned that project over to our counseling center a year later. We're able to get those people trained and begin that work. And it's still up and running today. And I think another question that'll come in later will kind of pertain to that, in that our campus, our leadership, our chancellor, our provost bought into this. And so it sort of takes everyone. It can't just be one or two people on a college campus to do it. You have to have, you have to have everybody on board, and we were able to successfully do that. The next year, I was approached by the interim director of the William McGee Institute on campus, which is a substance abuse and mental health research center, about taking what we did on campus and expanding that in the state of Mississippi. We were fortunate to get some federal funding to be able to do that work. And we expanded to the state of Mississippi. And then the next year, the current year we're in now, we were able to expand that even further to neighboring states. So we partnered with the University of Alabama, University of Arkansas, and a medical group called Mississippi and Art Care, and was able to expand the work that we're doing. And our mission right now is to do mental health first aid instructors and training in the South, community-based to campuses. And so I'm happy to be on the call today, that's who I am and how I got here.
I love it. Thank you so much, Allison. Sounds like you're really bored down there. No.
A lot
So,
of work, a lot
yeah,
of work, but
right.
happy to do it. So
So excited to have you with us today.
thank you.
Dr. Anderson, I'm going to kick it over to you to introduce yourself.
Good afternoon. I was going to say good morning. Thank you also for having me join the conversation today. I really appreciate the opportunity to share our experiences at the University of Rhode Island. I am a clinical psychologist by training and the director of the Psychological Consultation Center at URI. We are the graduate training clinic for the Department of Psychology. So my day-to-day involves a lot of supervision and training and clinical, service on campus. We brought mental health first aid to URI in 2017, so actually just before COVID hit. So we went through the whole big pivot, in mental health first aid when we went from in-person to learning how to do it all virtually. And we did it much like Dr. Ford Wade talked about. We had some very invested members of our campus leadership, one of whom was our provost, who put out a call for 3 proposals that he was going to fund to support our campus community, innovative ideas. And we submitted a proposal involving mental health first aid and came in number 4. So, he said to us, I know you're number 4, so I can't give you the full funding, but this is too important not to commit to. So he still gave us seed money. It wasn't the original amount required, but not only did he invest, in and recognize very early on that this was something that was going to be really important to the well-being of our campus community, but he also gathered all of our campus leadership. So all the vice provosts, all the vice presidents, all the student affairs directors, and they were our inaugural training group back in 2017. They were leading by example. So we have really found ways to institutionalize mental health first aid through continuous funding through SAMHSA and SAMHSA grants, to find new ways and creative ways to get this curriculum and get this type of training out to our campus community. So that's it.
Very impressive. And I am really looking forward to learning more a little bit about how um, maybe some nuts and bolts of the process about getting mental health first aid as a credit bearing course. No small feat. I know that's for sure. Um, Great. Thank you, Dr. Anderson. I appreciate it. Alicia, I would love to yield the floor to you to share a little bit about you and how you found mental health first aid at UNC Chapel Hill.
Thank you. Hello, everyone. I'm Alicia Freeman. I am the Mental Health First Aid Program Manager at the University of North Carolina at Chapel Hill. And our program is located in the Behavioral Health Springboard, which is a department in the UNC School of Social Work. So a few things that are very similar to Allison and Lindsay's story are the leadership buy-in and the campus partnerships are so essential. I was initially trained in 2019 and so had a similar COVID story. My first mental health first aid training was supposed to be the week that we didn't come back from spring break. And so I had to cancel that, and then we got new guidance from the National Council about hosting trainings virtually. So I jumped on that and we transitioned to virtual. But our university has been doing mental health first aid training since 2015. At that time, it was through grant funding. And so it was just, whatever we could offer within that limited funding amount. And so once our grants ended, it was around 2022, and the school decided to submit a proposal to the chancellor at the time, which was Kevin Guskowitz, and he approved that proposal, which formalized our mental health first aid program. So there's also like that formalization and dedicated staff that's necessary. And so when that happened, I was already training as part of student wellness in another role, and I applied for that coordinator position and helped to kick off our campus-based program at UNC formally. And I'm also a licensed clinical mental health counselor and a licensed clinical addiction specialist. So I love to have a foot in the macro world and talk about, large scale, but then also that one-on-one piece of supporting individuals and answering those questions that come up during trainings. And yeah, I think that's me.
Oh, that's beautiful. Thank you so much, Alicia. I mean, such highly skilled, incredibly powerful advocates for mental health first aid on the webinar today. So without further ado, I'd love to just start getting into some questions here and in hearing from each of you. So Lindsay, I'm actually going to ask you the first question, if that's okay. So thinking about, again, every college and university is different. There's some things that are familiar, some things that are kind of across the board per se, but every student body and every campus is a little bit different. But I'd love to hear from your vantage point what you think are some of the most pressing mental health challenges that students face today, and how have those evolved or changed over time in your experience?
Yeah, so, I think that there are, we are continuing to see a lot of the same pretty standard mental health concerns, that you would expect to see that we hear about in the literature, lots of depression, a lot of anxiety, probably the leading cause of referral to the counseling center or to spaces like ours, in the psychological consultation center. The legalization of marijuana has sort of ramped up issues around substance use and complicated substance use. I think that, and we are seeing a lot more over the course of the last couple of years, eating disorders, students presenting with eating disorder related behaviors, and very complex eating disorders. I think that one of the things that I would say has changed. There are a couple of things that I think have changed over time. I think that the presenting concerns of students coming into clinical spaces is significantly more severe at this point in time than perhaps it had been. Students are waiting longer to get into services, perhaps because they feel like their concerns don't warrant intervention, or they don't believe that people are going to be able to help them. They feel pretty hopeless and helpless. So lots of very complex, very severe mental health related concerns. Our students are also, despite efforts to reintegrate post COVID, really feeling a sense of isolation and disconnection, from each other, from our faculty and staff. Lots of our interactions on campus are so harried and so sort of wrought with stress that they become super transactional. So even when we're around other people, we're not really with them. And I think that that really has a significant impact on our student body, feeling like they should feel better because there are people around, and yet they don't feel better. I would add to that, I think that, with the changing, sort of national environment, students are facing many more complicated spaces of uncertainty and instability, financial instability, uncertainty about their future. They're really reporting feeling kind of out of control and helpless, with
Mhm.
lots of things that are happening around them. And I think that we have not been able, not we in Rhode Island, I think we in higher ed have really, we have struggled to sort of keep up with new and creative and innovative ways to tackle some of these issues because quite frankly, I think even as faculty and staff, people are feeling them, feeling these same issues in different ways. Um, I think lastly, actually, and this kind of is a post-COVID remnant that, and then maybe not a remnant of COVID, but I think that more and more we are really trying to advocate for students to talk about and think about and interact with their intersecting identities, really to explore those things and to examine spaces of privilege and power. And I don't think that higher ed has been able to keep up again in terms of support for those intersecting identities. So we're asking students to lean into those spaces.
Mhm.
Higher ed institutionally, I think, is having a really hard time keeping up with. Now that our students are doing this, what do we say? How do we support them? What resources do they need? Because it's not just the standard one size fits all 1 hour a week kind of clinical service.
Right, right. And we know, I mean, mental health and well-being impacts every single aspect of our lives. And at such a crucial time where, students are in this space of learning and they're developing new ideas and, figuring out kind of their, values exploration and things like that, there's bound to be, some conversations around boundaries and barriers and whatnot. And you even touched on it earlier in what you mentioned. You talked a little bit about kind of long lines for the counseling center, and perhaps students don't feel as though they are, or the things that they're experiencing are noteworthy, or there's the lack of help-seeking behaviors when it comes to certain things, right? And the urgency around some things they might be experiencing. What do you think, or what has worked for you, or perhaps what are your thoughts around removing barriers to access for students when it comes to mental health services and supports on campus?
So I would say, probably three things. I think that the integration of mental health first aid, quite frankly, has been huge in terms of reducing barriers because we are really sending the message to our campus community that this is our campus responsibility, right? That mental health can't fall solely on the counseling center. Again, that model
Right.
doesn't work. We all have a responsibility to participate in that conversation and to support each other and to be looking out for these things. And we all have a role to play. So, we recognized that, we started off, only offering mental health first aid to faculty and staff, thinking that's the best way to get to students. We're going to
Mhm.
train the faculty and staff. And then very quickly realized that our students were clamoring for something. Again, I talked about them feeling out of control. So we started offering mental health first aid to students. And then very quickly realized students don't have any time. There's no extra time in any student's schedule for anything, on top of their core
Right.
courses. So we went to our leadership at URI and we said, the only way to do this effectively is to offer students credit. So that they can build it into their coursework, so that they can get credit towards graduation, so they're building their CVs, so it is in support of their larger sort of academic progress. It reduces barriers in terms of equity around the costs of trainings, and again, sort of availability. And we We offer probably 6 or 7 sections of mental health first aid as a course each semester, and we fill those courses to their capacity. 30 students every single section. We offer it during our J term, we offer it during the summer, and that has been a game changer for us. I also think that in higher ed, we have to be looking more creatively at how do we reach students. At URI, we've started to integrate animal assisted therapies, having, therapy dogs around campus and looking at supportive strategies for connecting students with health spaces. So whether it is, auricular acupuncture that's now being offered in clinical spaces around campus, or simply telling students that the only resource is not the counseling center, right? We have all of these spaces on campus where students can find support and they don't know about it. They don't realize how they can be used.
Mhm.
Nobody talks about how they are pathways into other clinical spaces if needed. So I think that those are some of the more important things that we've done at URI that have really, really been impactful.
Yeah, I mean, what tremendous work you've done with your students there and really helping students, faculty, and staff understand that mental well-being really is a community responsibility. I love that you said that. I actually have about a decade plus of experience in higher education on various types of campuses with various types of students, and um, some of the things that you said really resonate with me, and just kind of meeting students where they are and really inviting them to be a part of the conversation, right? Opening up mental health first aid to students, finding ways to integrate it into their already busy and very competitively timed schedules. Um, One of the things that I used to think about quite a bit with students at the schools where I worked, um, well-being is something that's very layered. Some of the challenges students experience start kind of small-ish, if you want to call it that, and then they build a compound and become really, really, really high-level challenges. I bet all of us on the call probably have heard a student at one point or another maybe talk about how they don't sleep enough, right? The foundation of all they do is not being well rested. So, Alicia and Allison, I'd love to kind of extend that line of thought and question. We're, hearing from Lindsay about how mental health first aid was embedded through a credit bearing course at URI. I'm wondering, as faculty and administration, how can faculty, staff, and admin play an active role in supporting student mental health? Or maybe another way to ask that question is, what are some proactive trainings or maybe resources that are essential for success when it comes to student mental health on campus?
I would say just again, making sure that we are hitting students from every angle, if you will, like from the
Mhm.
resident halls. And so residence halls to the faculty, including this into their coursework, just discussion, just 2 minutes before, after a class of how are things going. And so I think there's still a level of education that needs to occur on campuses
Mm.
about trainings and what's going on. I mean, I think there's a whole subset of faculty, staff, students that don't even know anything that we're talking about today, that they don't know that we even have these trainings or have these. And so communication is always a key. Um, but I think just, and Lindsay eloquently said this, right? It's not just faculty or not just staff. I mean, you have to have
Right.
everyone on board, or you're not going to reach everyone. And so I think we've been successful at Ole Miss at reaching out to athletics, reaching out to residence halls. And we even incorporated our alumni initially, and said, hey, we have local alumni. They're very involved in our campus. Like, they're serving on committees. We have a pretty good relationship, like with our community. We're small, in Oxford, Mississippi, we're small. And so we were able to reach out to our local community, to their mayors, all these people, and just say, hey, we have this initiative going going on. We want everyone, right? We want this, and I know this is, I don't work for the National Council, but we want everyone to know, just like everyone knows what American Red Cross first aid, right? We want everyone to know about this, to have some, some level of understanding and training. And so I think it takes a lot of work to get everyone there and on board. But I think that's what we should do on all different levels, and not, our counseling centers are so packed and so booked, and so I think it is going to take more people coming to the table.
Right, right.
Yeah, I think you have to have that campus buy-in, and that has to start from the top in terms of infrastructure and support around these trainings and around implementing this type of program on campus. But I think one thing unique to campus organizations is that research and development piece, and how you can really hone in on your specific, your unique cultural characteristics of your campus, and maybe even civil issues that are specifically connected to your campus. I also know that at our university, or in our program, we have a resource booklet that we update annually, and we've also used that same type of template to modify that for other folks who are making requests for trainings. So I think, having those resources available, but definitely kind of looking at everyone you work with as a partner in mental health first aid, like the participants, and we get different departments to host trainings for their staff in their department. And so I feel like at every angle, even like what Allison was saying, like with the housing, we are doing RA orientation, they get trained in mental health first aid. And so actually one of those students has been awarded a scholarship to get trained as an instructor now. And so,
Great.
it's just really a ripple down effect. I think if you just think about all the connections, and it's not just us learning how to take better care of ourselves and our community, but it's also workforce development for some of these folks who are interested in pursuing a career in mental health or behavioral health.
You took the words right out of my mouth about workforce development. I know that Springboard, the School of Social Work at UNC Chapel Hill, does a really dynamic job of incorporating workforce development into the conversation alongside mental health first aid. Alicia, I'm going to stick with you for a second because I have some follow-ups. Every campus is going to be a little bit different, right? Like there's going to be campuses that have on-campus living and residence halls. There's going to be predominantly online schools, schools that have, different age college students that are perhaps international. We're all just trying to, as college administrators or as folks who work in higher education, just trying to figure out how to meet students where they are, right? Depending on where they are and where they're from and what they're about. So I'm curious, Alicia, from your perspective, what kind of impact in your experience does that peer support, right? Teaching other people how to support other people. What kind of impact does the peer support function have on a campus culture?
Mm-hmm.
Knowing your initiative works dynamically in this space. And how can institutions like the ones represented on the call or in the chat really foster supportive environments through peer support? And how can that impact student well-being?
Yeah, absolutely. I think that's probably one of the most therapeutic things about mental health first aid. Like we always tell folks, this isn't therapy. There might be some therapeutic elements for you, but I think it's that connection and that peer connection and that community connection, and realizing you're not alone, realizing that everyone in that space essentially wants to try to fix this and support each other in this and recognize it as a health care concern. We have what is called the Carolina Peer Support Collaborative in our School of Public Health. And so we partnered with them to start creating a peer support pod. And so we haven't actually been able to launch this off the ground, but we have the infrastructure and we are ready to start scheduling those meetings. And what we're really deciding on now, which I think we've kind of narrowed it down, is were we just gonna have all of our mental health first aiders just first come, first serve, show up, which that might be how we start out, or do we want to do more like a student group, a staff group, a faculty group, because we let our public trainings are open to anyone, our public schedule. And so we do have students, faculty and staff all in the same training. And it's just really eye-opening experience to see kind of the different perspectives and then be able to learn from each other, and even faculty recognizing some of the students' concerns that they may see behaviors, but they may not understand the underlying causes of that. But another resource we have that is actually hosted by our peers is the care.unc.edu, which is called our Heals Care Network. And that's like our online hub for everything mental health. So they can go on there and they can find trainings, because of course our school offers other trainings like QPR or other suicide prevention or mental health type trainings. So I just really see like that peer support piece. We're even trying to see now how we can work in with our peer well-being coaches in the School of Social Work. We have a program where some of our doc students are wellness coaches with their peers and other students in those programs. And so we have been getting them trained as mental health first aid instructors, and they're able to partner with our program, but also see how we can synergize that a little more to where it's almost like anytime you see peer well-being coaches, you also see mental health first aid. But it really is necessary in all those spaces, because like Lindsay was saying earlier about the loneliness and the isolation, that's where shame just breeds and grows. And so how do we address that? By peer support networks and having those community connections.
Yeah, you're not alone. Somebody is here. Somebody cares about you. And yeah, absolutely. So I have one more question for all of you. And I'm going to try to keep it short and sweet, but I doubt it. I doubt that'll happen. But I'm curious to know from each of you, and Allison, I'll start with you. What's working, I guess? What's working when it comes to positive impacts on student mental health and well-being? And I guess the other part of that is, what do we still need to do? Like what are we missing? I guess, so what's working and what's missing?
Well, one of the things that worked for us was, and I feel like I've already said this, but one of the things that's worked for us is to get our chancellor's buy-in. He developed a new initiative post us doing this initial work and sort of brought the campus together. Another sort of fun thing that occurred for us that sort of set us aside, I think, at the time was our head football coach, Lane Kiffin. He bought into this. His director of psychological services and athletics, Josie Nichols, she was one of the inaugural mental health first aid instructors that we paid to go through the training. And I'll be honest, at first I sort of thought she has a PhD in psychology, but we have gotten so much from having her, because she set out on a mission. And Sports Illustrated did an article on the fact that the Ole Miss football program was the first football program in the country that again, the head of the football program said everyone is going to do this. And then to go a step further, and we didn't even know he was going to do this, but when he went to SEC Media Days, they asked the coaches to talk about two things. And I don't remember what his first thing was. I'm sure it was on a quarterback or something. But his second thing at SEC Media Days, when he has all of this attention, is my staff is mental health first aid trained. I have bought into this. all of the rest of the coaches across the country need to do this. And so immediately, right, we had publicity and press and interest and incoming freshmen coming in saying, wait, what is this? And so for us, it's been a handful of people that we've been able to, understand what we're doing. And so that was successful. And what still needs to happen is, I hate to kind of say the same thing over and over again, but education. We need more people that
Yeah.
understand what this is, understand what it's about, and we're now doing a lot more in the community based, and for coaches, for teachers, for youth ministers, for anyone that works with you, you need this training. And so, and what I've said is anybody that has children needs this training, right? Because they're going to hit hit youth, ages 12 to 18. They're going to hit those times. And so, I just think I've really bought into this. I think that everyone that breathes and has a heartbeat needs this training.
Yeah.
So I think we need more education, more awareness, and and a little bit of luck, I guess, if you will.
Right. Lindsay, before I pop over to you, Allison, I have one quick follow-up.
Sure.
The first thing you mentioned off the top was, your chancellor bought into this. Now I know that was probably presentations and, lots of culling of data and whatnot, but I'm curious, what do you think it was that solidified the buy-in? And how can folks replicate that if they're asking themselves the same questions?
You're asking what from the chancellor's perspective? I
Hmm.
think he listened to our staff, and he listened to the director of the counseling center. And he does. He listens to what is
Yeah.
going on. And so I think from that perspective, and it was kind of a beautiful handoff. We were able to hand that back over and say, we've done this initial work, now grow it, and so our student health services, our counseling center, I mean, it's just had tremendous buy-in.
Yeah.
So that I
It's
think,
that
yeah.
it's that community engagement, community responsibility, right? Like you had multiple staff, faculty come together and say, this is something that's important to us and it's going to be important to the fabric of our campus, right? Like those are the conversations that I think are so critical and so encouraging to hear that are happening, right? Like leaders are listening. So I appreciate you letting me ask you a little follow-up
Oh,
there.
of course, absolutely. And look, there's still a lot of work to be done, I mean,
Right, of
we haven't,
course.
yeah, but even calls like this, hearing from other people around the country to see what they're doing, and I don't we didn't discuss this before, but when I first started this work, I did a Google search and I found Chapel Hill, and I reached out to the director at the time and said, "Hey, can I set up a Zoom with you and understand the pros and cons? Like, how did you guys get to where you are today?" And so I think just reaching out to other campuses and seeing what works on your campus and what doesn't. And so I think that's
Right.
beneficial.
Well, I think you all might have made some fans out of some people today, I bet. Lindsay, what are your thoughts? What's working, and what are we missing?
I think for us, one of the most successful things about our effort to do this was that we have instructors who are embedded across campus. So, I'm in psychology and that's great. And people expect things like this from me in psychology. But, to Dr. Ford Wade's point, we have an assistant athletic director who is a mental health first aid instructor, and it is now required of all of our athletic coaches and training staff. And they are the only area on campus actually who has made this a requirement. We have assistant deans of students who are instructors. We have faculty who are instructors. We have the director of conduct who is an instructor. We have a campus safety officer who is an instructor. And I think that seeing all of us and all of us working collaboratively together, because we have monthly team meetings, and talking about our experiences and our perspectives and sharing our knowledge from our spaces helps us to be more effective at the delivery of mental health first aid across campus. Annually we train over 1,500 students, because we start with those target groups like Alicia was talking about. We start with our RAs and we look at all of the TAs and GAs and RAs, who are teaching undergraduate students, and we get in with the graduate school and, where can we start with the biggest bang for our buck? If we need to start with a core group of people on campus, who is that core? I think in terms of next steps for us, ideally, what we would like to see happen is that mental health first aid becomes a requirement. It becomes a hiring requirement through HR for all faculty and staff. It becomes either a graduation requirement or a first year requirement for all students so that before they graduate from URI, they have this certification under their belt. And quite frankly, when it comes to leadership engagement and investment, it's a real selling point to our families, right? The families of all of the students who are coming in to hear about mental health first aid, to see that URI cares about the mental health of their babies who are away from home for the first time, maybe across the country, doing things that are hard, and to know that we as a community are invested in their well-being and are doing all of these things across all of these spaces and all of these stakeholder groups. I think it's good for our students and it's good for their families, even though their families aren't on campus with us. So, we are also looking at trying to train families of first year students during orientation, getting their parents involved. So when they're across the country and their students call and say, I'm homesick and I'm lonely, and these are the things that are happening, that they also are trained and know what to do. But I think that those are some of the things that are going well and some of the spaces that we want to move into moving forward.
That's great. And I'm really glad you touched on parents and guardians and family members in general being such an important part of the conversation, because they are, oftentimes they're the students' biggest champions when it comes to, their success and their progress. So making sure that they know that they have a place in this conversation is really important. And again, you're sending this, your child, now your student, into a space and wanting to make sure that that space is a healthy one for them. So I appreciate you sharing that. Alicia, I am going to end with you. What is working and what is missing?
Well, I think what is working is our instructors continue to be, very passionate about the work. They continue to promote mental health first aid across campus in the various departments that they work in. So those partnerships are definitely working. I think also that targeted outreach. And so, making sure that the folks that are most vulnerable are getting this information, and then those who will mostly be in contact with folks that they may be supporting will be getting this information. I also think the fact that we put out a schedule that is just all the trainings that'll be available, and those are in person and virtual. But then we also take requests from groups. And so I think that is helpful, because not only does it allow, say I'm just one solo single person that wants to sign up for a training, I can go find one. But if none of these trainings work for our group and we want to train our whole organization, I can also ask for that and get my needs met in that way. So I think, also what works is being accommodating where we can, because the curriculum is the curriculum, and that's awesome, because then we don't have to put any brain power to that part. We know we will deliver that to fidelity, but what other things could you modify or accommodate, or, add on, like where we've done different resources, like we partnered with a church organization for a grant with the partnership with the School of Medicine. So it was School of Social Work, School of Medicine, and we supported some churches in one of our rural counties to receive mental health first aid. But we made these scripture cards that will all of us as a team kind of made those scripture cards, and we had an intern work on making them all pretty. And so that was a resource we were able to hand out at that at those events and those trainings. So there's all types of things that could come out of it if you actually have some of those focus groups. We had a focus group just because it was a research project, but community conversations or just getting that information about what would be helpful to that specific community that you're serving, or department or organization, that has been something that has been working, and then that makes them go and tell more people. And and so
Right.
then that's also a long-term partnership, and they may request another training. Like we have folks who request those annually, or they request like a few a semester. So I think, sustaining as things are developing, sustaining those partnerships has just been, pivotal.
That's so great. I appreciate that. I'm gonna give you all a break, so you can just take a beat. And I'm going to turn it over here to my fine colleague, Ashley Connor. Ashley is going to talk to us a little bit about something you all have already talked extensively about, mental health first aid for higher education. So, Ashley, I will run these slides for you. You just tell me how to drive.
I'm ready. That's a tough group to follow. What am I doing here? Well, hello everybody. I have been going through the chat and the Q&A, and I just love my job so much today. Just all this mental health first aid love. It's just really, it's really lovely and uplifting just to see everybody coming together. I'm noticing people wanting to connect with one another and collaborate, and I just, gives me the warm fuzzies. I have some goosebumps. So my name is Ashley Connor. I am our senior client development partner here at Mental Health First Aid. I may have talked to some of you already at some point in time in life. My role really surrounds supporting organizations with building their instructor networks and really supporting mental health first aid initiatives. I've had the privilege of working with Alicia and Allison for multiple years. Lindsay and I have chatted a couple of times via email. So done a lot of great work with all of them. So today, I think Janice Ann has the slides up. I don't know, I can't see. So we're just gonna kind of talk through a little bit about who should take mental health first aid, what is it, what's it all about. All of you, again, from the chat seem very, very skilled in already what we're talking about and what we're doing. So really today we're talking about how can we bring this to higher education institutions. That is one of our primary target audiences, all the way from these huge private or public schools all the way down to community colleges, and everything in between. So we are everywhere. We are in over 650 institutions nationwide, which is very, very cool. Really, what drives the impact? How does mental health first aid help? So we are preventing those mental health first aid challenges from impacting student performance. All of our presenters today, right? Students are busy. I remember being in college and I didn't have time to do really anything. I was bopping between a job and going to classes and, socializing, of course. And so really being able to find that time and prioritizing our own mental well-being, let alone the student support services on campuses, are kind of struggling right now. And so even being able to get that support in place. We want to improve that resilience. We are trying to teach these young people to go out into this world. And my goodness, we need a lot of resilience to be able to do that. And how can we take care of ourselves? And how can we open up these conversations? Early intervention, right? Evidence-based practices are really important. So how are we able to hopefully be preventative and really work with these populations on campus to help support them? And not only on campus, but off campus. Like, your life, right? What are you doing with your friends, with your families, within your communities? How can we support you? So that's really what drives this impact. We want to, get them ready for their jobs, their careers, all of that. So we're going to go kind of that next slide. So what does mental health first aid teach? Again, looking at the chat, you all are like, we know this, Ashley. We know what algae is. We got it. But I'm going to tell you anyways, just in case you're new here. So really, again, evaluating that impact of early intervention. It's really practical skills based learning that we're really teaching anybody who goes and learns this curriculum, whether it's faculty, whether it's staff, whether it's the students, how to respond effectively to these real life situations. Some of you may have talked to me and have heard me say, you get the real answer or you get the polite answer. Every day we talk to somebody and we say, how are you doing today? Polite response is, I'm good, thanks. How are you? The real response might be different. And what do we do in those real moments when somebody comes up and gives us a real response? How do we then interact with those people? We want to make sure that we're feeling empowered and feeling okay about having these conversations. And so, unlike other programs, we're focusing on that awareness as well. So we use that mental health first aid action plan, algae, that 5-step action plan. We want to be able to recognize signs and symptoms with those scenarios that we provide you. The scenarios are fantastic. We want to be able to give you real life situations that you might encounter. We don't want to give you a video from the 80s with the blockbuster that doesn't really have any relevancy to your life at this moment in time. Some of you are like, what's a blockbuster, Ashley? That's okay. So we want to make sure that we are really able to give you real life situations and scenarios. We want also to make sure that you're feeling comfortable and you're feeling safe in these situations. We want to assess. We are constantly talking about, we're not here to diagnose anybody. That is not our role. That is not our responsibility as a mental health first aider. Our role is here to help support you in whatever capacity that may mean. Maybe that means you just need somebody to talk to. Nobody's asked you how you're doing, and you just need a space to vent. Cool. I can be that person for you. Maybe you need a little extra. Would you like me to sit with you when you make a call to your mom or you make a call to your therapist? Do you just want me to be a body in the room for you? Or maybe we're kind of up a level and we need to, go actually really talk to somebody at student services, or we need to kind of get you into calling a crisis line or whatever else it may be, calling 988 or texting 988, all of those things. How can we support you? And really just addressing the stigma, right? We have done an incredible job. All of you on this call, I can say with 100% certainty, are just out there spreading this word that mental health affects every single person in some way, shape, or form. But that message still gets lost a little bit. So how can we still reduce that stigma and say it's okay to talk about these things? It's okay to say, I'm feeling a little down. I am feeling really anxious right now, or I got this going on in my life. Those are all okay things. And so mental health first aid really teaches us how to embody all of that and in those real world situations. Okay, so next slide. So that's all great and well, generalized. So what about the on-campus life, the situations, what we're here today talking about? So how campus mental health training helps, right? So across the United States, we have over 45% of colleges that students that are struggling with their mental health. Again, they're going back. There's so much going on in life. We've got friends, we've got school, we've got family, we've got jobs, and everything else in between. So prioritizing ourselves can be really, really challenging. And what happens, right? We got to feel like we kind of have to drop something. Well, what drops? Our education, because it feels too overwhelming, maybe. We just need to get something out, and that's what gets cut. So it contributes to this soaring degree of incompletion rates of like 39%. So, you see some of these stats. We've got 49% of these students struggle with mental health. So again, our goal is to improve the mental resiliency within these young people, set them up for success, not only on campus and in what they're doing and involved in, but also off campus as well. We've got 33% of people who drop out, right? Because of mental health challenges or mental health reasons. So we want to be able to address these, help support them. Especially because we want it to be preventative. We don't want it to turn into a crisis. We want to be able to help support them in whatever way is possible to prevent that from kind of taking place. And then we have our staff and our faculty. We have 40% of staff and faculty who don't feel prepared when students are coming to them and talking to them about what is going on in their lives. So we want to help those folks too. We want to increase their resiliency. We want to empower staff, faculty to be able to have these conversations. I know I've talked to several professors who, are in like art. I talked to one professor who was an art professor, and they were like, I am so grateful that I took this course because a student came to me. I wasn't expecting it and I wasn't prepared for it. But because I had this class, I could actually sit and talk to this kid. And I'm not in the mental health world. I'm in, and I'm like, well, you're in art. Art therapy is a thing, and art is very, can be cathartic. But they were able to use that and see how helpful it was and empower them. So we want to be able to build that confidence for all of our staff and faculty on campus as well. Next slide. Excuse me. No, Janice, you? Yeah. Okay. So, oh, sorry. I'm looking at my slides. Just kidding. I have to click my slides. Love that for me. Okay, so we are moving into outcomes. So when we are building this up and we're bringing it out and we are facilitating mental health first aid on campuses, we are seeing that students are feeling and responding and feeling more confident, right? So 75% of students are reporting this, along with staff and faculty. So really any person that is taking this training on campus is reporting that they're feeling more confident. We have people who are recognizing that they are increasing their mental health literacy. So again, going back to that stigmatization, we talk about using person first language. We talk about, oh, the weather's being so bipolar today. Maybe I say that and I don't really have a comprehension about what bipolar is and how that could maybe be a little offensive and why I maybe shouldn't say that. But now, because I've gone through this course, I truly understand why I maybe need to change my language up a bit and what that truly means. So we're just giving information, we're giving knowledge. And then that empowerment piece. 54% of people are now feeling more empowered and likely to help somebody support them if they need that, or if they're asking for it, or maybe they're even feeling confident enough to open up that conversation themselves instead of waiting for that person to come and ask them. So those are some of the really amazing things that we're seeing as outcomes when we're bringing mental health first aid onto campuses. Okay, next slide. So who should take it? Everybody, everyone. It is meant for everyone to take. We want staff, we want faculty. I have seen so many people in the chat talking about RAs. We had a lot of people talking in there about athletics, right? Your coaches, your trainers, your student leaders, your Greek life members, absolutely, and general student population. I know that somebody jumped in there, earlier talking about like, who do we give this to? Absolutely everyone. It's so important that we're able to all speak that same language, if you will, right? So if I start talking to someone, we want that 1 in 15. So your small circle, We want to be able to say, oh yeah, I used algae the other day. We want, if we're in a small group, we want somebody else to be like, oh, I know what that is, or oh, I heard about that. We want to be able to, really be able to have that conversation fully. Um, Danielle in the chat also brought up a really good point, and I love that you said this. That we want to make sure to think about the staff who might not always be considered as student facing, right? So we have like our food service people, we have our janitorial staff. There are so many touch points on campus that students, are engaging with, or faculty and staff are engaging with. We don't know who we're going to connect with until it happens, and it's that moment. And so it's not just designed for your executive leadership board and your presidents. It's not just for your behavioral health teams. It's not just for, your behavioral health sciences groups even. It's for everybody, so that we can all start to feel a little bit more empowered to have these conversations. Okay, that was my allotted time. I feel like I talked really fast, but I'm going to pass it back over to Jay. Thank you so much again. I love, love, love going through this chat. I'm going to just kind of keep sifting because you all are just incredibly inspiring.
Thank you, Ashley. You're such a wealth of knowledge. We so appreciate you being here with us, and hopefully getting folks started on thinking about how to engage mental well-being conversations on their campus to improve student wellness. So yeah, thank you so much to everybody for joining us today. We were so delighted to share some time with you. Wherever your campus is, whatever it looks like, whoever your students are, we hope that you were able to garner some good tips and some good insight, and hopefully some really engaging ideas to take back to your folks on in your spaces. So would love to get your thoughts on today's webinar. You can scan this QR code here to get started. We'd love to hear your feedback. If you also have additional questions about today's webinar that we weren't able to get to, or perhaps a burning question that we didn't get a chance to answer, I personally could spend hours with all of you. Please do take down this MHFA CDM at thenationalcouncil.org. That'll connect you to our team who is at the ready to answer any questions you have. Thank you so much to everyone. The recording will be sent out to registrants. We are just so grateful that you've joined us for such an important topic, such an important time. So wishing you the very best, the very kindest of days. And thank you again for joining us. Have a great day.